Hello viewer, and welcome to the Mental Health Program brought to you by Hope Channel Kenya and myself, Florida Afifu. I am a clinical psychologist and I'm happy to bring you these programs for mental health awareness and also to promote good mental health. We have had episodes in the previous where we talked about mental health, trying to get understanding of what mental health is, how mental health relates to our physical health, and how we can sustain good mental health. We went ahead and discussed positive thinking and stress management as steps to maintain good status of mental health. Today, we want to move to the next level and discuss another subject which is very, very important on matters mental health, and this is mental illness. So what is mental illness? Mental illness, also referred to as mental disorders, are mental conditions that affect our mood, our thinking, and our behavior. This means that when one suffers mental illness, then the symptoms will manifest in their mood, the emotions that they feel, and how they express those emotions. It will also manifest in their thinking, by virtue of the kind of thoughts that dominate in their minds and how they process, and also manifest in behavior. Many people have mental health concerns from time to time. Mental health concerns are not mental illnesses, but mental health concerns can develop into mental illnesses when ongoing signs and symptoms cause frequent distress and when ongoing signs and symptoms affect one's ability to function. Kenya has a high burden of mental illness due to ill health, due to psychosocial disability, and premature mortality with huge gaps in access to care. Research has shown that 1 in every 10 people in Kenya suffer common mental disorders. This number however, increases to 1 in every 4 people among those who seek routine outpatient care. Depression and anxiety are the leading mental illnesses diagnosed in Kenya, followed closely by substance use disorders. Among the different substances of abuse that cause mental illness, alcohol contributes the largest burden of substance use-related illnesses in Kenya. And unfortunately, the age group that is mostly affected is the youth of age between 18 years to 29 years of age. The rising number of mental illnesses in the country is a cause of concern. Mental illnesses that are common in the country sometimes go to severe levels, resulting even into suicide. And therefore, this is a matter of grave concern, and as such, we need to engage in discussion on issue mental health. We need to reduce the stigma associated with issues of mental health, and we need to increase access to mental health care services. What are the symptoms of mental illness? Or how would one know that they are probably suffering from mental illnesses? A mental illness emotionally will cause someone to feel sad and down most of their time and over a prolonged period of time. Some mental illnesses that causes us to feel low and down over a prolonged period of time have got intervals of happy moments, extremely happy moments that are not sustained over time, and one is most likely to drop down into the sad and low moments. Another symptom for mental illness is confused thinking and reduced ability to concentrate. Excessive fears or worries or extreme feelings of guilt could also be a symptom of mental illnesses. Extreme mood changes of highs and lows, where one at some point is very high, very happy, very energetic, with intervals of lawlessness, could also indicate that one may be suffering from mental illness. Withdrawal from friends and activities, especially in the cases of depression, is a show that one is struggling with a mental health ailment. Mental health ailments also cause significant tiredness, low energy, or problems with sleep. A person suffering mental illness may find it difficult to sleep, or they may find themselves sleeping much longer than usual. Inability to cope with daily problems or stress is a sign of mental illness. Some people suffering mental illness may have trouble understanding and relating to situations or to people. Problems with alcohol or drugs can result as a result of mental ailments or can result and can be considered as causes of mental ailments. Major changes in eating habits, where someone eats much more than usual or eats nothing at all, or eats and forces themselves to vomit or remove what they have eaten, could be an indicator that one is suffering mental illness. Changes in sexual behavior also is a show of mental illness. Excessive hunger, hostility, and violent behavior is also another symptom of mental illness. Another important symptom to note is detachment from reality, where one is either delusional. In delusion, one holds beliefs that are not real, even in the face of the reality that is around them. Detachment from reality may also be in the form of paranoia, excessive fear of situations or people or things that are really not supposed to cause fear. Another way detachment of reality manifests is through hallucinations. Hallucinations is where one hears voices or senses touch, senses smell, or senses, they can visualize things that are not real. And also another very important perspective or symptom of mental illness is suicidal thinking. Most mental illnesses can lead to suicidal thoughts. And so when you have these symptoms, then it could be an indicator that one is suffering from mental illness and there is need to get attention from mental health service providers. Now, it is important to note that symptoms of mental illnesses vary depending on the type of illness that one person is suffering from, the circumstances of an individual, and the severity of the illness, and of course, there are other factors. Stress has a negative effect on mental illness. Stress worsens the symptoms of mental illness, and stress can see an onset of mental illness. Sometimes symptoms of mental illness appear as physical problems, such as stomach pains, back pains, headaches, and other unexplained aches or pain. This is what we otherwise refer to somatization, when the physical body expresses stress and symptoms of mental illness through the mind and body connection. In our first episode, we talked extensively on the connection between the mind and the body. And we said that the relationship between the mind and the physical body is so intimate that when one is affected, the other one sympathizes. And it is by the virtue of this connection that sometimes symptoms of mental health may show in the physical in these ways that we have listed there above. The presence of these symptoms in an individual should be a cause for concern. However, proper assessment is necessary for one to be diagnosed with a mental illness. And this assessment is done by a mental health professional. I talk about psychologists and psychiatrists who are the professionals in the field of mental health. There are different types of mental illnesses, and sometimes the symptoms overlap. A proper diagnosis is necessary to establish which specific illness one is suffering from, and also to be able to inform the best effective treatment plan that one can be put in. Having understood the symptoms of mental health and taken note of the important issues that I have outlined there above, let us now look at what causes mental illness. Mental illness, in general, are thought to be caused by a variety of genetics and environmental factors. So one cause would be inherited traits. Certain genes in our bodies that we inherit from our fathers and from our forefathers may put us at risk of developing mental illness. However, it is important to note that while one may be predisposed to a certain mental illness, it takes the environment or behavior to trigger the onset of mental illness. As we usually say, genetics load the gun, but behavior pulls the trigger. To explain this rather in more in-depth, I will take an example of somebody who comes from a bloodline where there is history of alcohol substance abuse. While the genes may predispose you, it is your exposure to alcohol and those substances of abuse that may see you getting into addiction and suffering mental illnesses related to the behavior. Another factor that is considered as a cause of mental illness is exposure to environmental factors before birth. Environmental stresses, inflammatory conditions, toxins, alcohols, and drugs while the baby is still in the womb can predispose the baby to mental illnesses. Therefore, it is important for mothers to take care of their lives, their lifestyles, to take care of what they expose themselves to manage their stress levels, and if they are suffering any form of illnesses, to be able to get Medicare and support so that this pregnancy period is safe for the baby. Another cause of mental illness is brain chemistry. Our brain uses neurotransmitters, which are naturally occurring chemicals that carry signals from one part of the brain and to the other parts of the body and back and forth. When these neural networks are compromised in any way, the chemicals are impaired and the functions of the nerve receptors and the nerve system change, leading to depression and other mental disorders. Our brain chemistry is a very important factor on issues of mental health. And therefore, it is advisable that we do not engage in the use of psychoactive substances that may change our brain chemistry. Now, what are some of the risk factors that may lead someone to developing mental illness? The first risk factor is a history of mental illness in a blood relative, such as a parent or a sibling or a grandparent, because this shows that one is genetically predisposed to certain mental illnesses. Another risk factor is stress-related situations, such as loss of a loved one, such as financial problems. Let me clarify that these risk factors are not necessarily causes of mental illnesses, but they can see an onset or predispose one further to developing mental illnesses. When stress is prolonged over time, then that stress may lead to an onset of mental illness. Another risk factor that we are considering today is brain damage as a result of serious injury, such as a violent blow to the head or traumatic brain injuries through accidents. I have already highlighted how brain chemistry can influence mental health and mental illness. And so when there is damage to the brain, then mental illness may occur. An ongoing chronic medical condition such as diabetes. If you look up in our third episode, you will see how we discuss the connection between stress and medical conditions, and how medical conditions can affect us mentally and cause mental illnesses. Traumatic experience such as military combat, assault, exposure to violent rape, or any other traumatic event that we experience can also cause mental illnesses. Use of alcohol or recreational drugs are a recipe and a risk factor to mental illness. A child history of neglect and abuse is a risk factor for mental illness. And self-isolation, where one lives with very few friends or without social interaction, is a risk factor for mental illness. And also, if one has suffered mental illness before, a previous exposure to mental illness is a risk factor. These risk factors expose one to mental illnesses. However, it does not necessarily mean that when you're exposed to these risk factors, then you must have a mental illness. It depends on how you experience your situations and your events. Two people may experience the same event the same way, in the same magnitude, but the results are different. One would end up developing mental illnesses, while the other person may not develop illnesses. It's more about how you experience your situations and your circumstances rather than the situations and the circumstances themselves. Mental illness is a leading cause of disability. Complications linked to mental illness may include unhappiness and decreased enjoyment of life. People suffering mental illness may find themselves in situations of family conflict. Oftentimes, you find that even the conflict between a couple may be precipitated by the fact that one spouse is suffering a mental illness, diagnosed or probably undiagnosed. Mental illness also results to relationship difficulty. Remember, we said that mental illness affects our mood, affects our thinking, and our behavior as a result. And so when our moods and our thinking are affected, it manifests in the behavior, and sometimes depending on the behavior that we show, we might have difficulties in relationships. Mental illness could also reduce one's functionality, one's ability to perform in their places of work or even at school. Mental illnesses result into legal and financial problems, poverty and homelessness, given to the fact that it affects our ability to work productively and achieve our targets. Some other complications include self-harm and harm to others, for example, in the causes of suicide or homicides that we have witnessed so much lately in the recent months. Mental illness could also bring complications with the immune system. Mental illnesses occasioned by the stress and the distress that it brings to us weakens the body and so compromises our immune system. Other complications include heart disease, social isolation, and problems with tobacco, alcohol, and other drugs. So the question is, what then should we do about mental illness? The first thing is to be able to be aware of the signs of symptoms of mental illness. And if you see these signs and symptoms, know that it is important for you to seek help. If you're already suffering a mental illness that is diagnosed, do not ignore the symptoms. Mental illnesses do not improve on their own if left untreated. And when a mental illness is not treated, it may get worse over time and even lead to serious problems. Suicidal thoughts and behavior are common with mental illnesses. If you think that you may hurt yourself or you may hurt somebody, then try and get help right away. Reach out to a mental health specialist. Reach out to a loved one. Reach out to your spiritual leader, a minister in your church, or someone in your faith community, and share with them what you're going through. You can also call a suicide hotline number to seek help from a primary caregiver. It is very, very important to note that suicidal thinking does not get better on its own, so you need to get help. Another thing that we can do is to help loved ones. If you suspect that your loved one is suffering mental illness, then you can openly discuss your concerns with them in a loving and a caring manner. Help them to get professional care. You can escort them to see their therapist, and you can be there to provide social support to your loved ones. Another way is to practice preventive strategies. Pay attention to warning signs. Work with your doctor and your therapist to learn what triggers your signs and make a plan on what you do when your symptoms are triggered. Contact your doctor and therapist if you notice that your feelings, your thoughts are changing, and consider involving family members to help you watch out for the symptoms, because other times when your symptoms present, you might not be in a position to identify them. Get to do medical care. Get help when you need it, and take very good care of your physical health by sleeping sufficiently for 7 to 8 hours each day, eating healthy, having a regular balanced diet, regular exercises, relaxation exercises to relieve our bodies from stress, and also to harness social support. Practice stress management skills so that you can reduce stress in all the dimensions of wellness. Positive thinking is an important way of helping or dealing with mental illnesses. Develop a good self-esteem. Inferior feelings brings down or lowers our defenses against mental illnesses. Keep away from psychoactive substances that exert the central nervous system and alter your mood. These are substances such as alcohol, drugs and substances of abuse, and caffeine. Face your difficult circumstances. Face your guilt. Face your pain. Face your traumatic experiences and process them. Resolve your stresses rather than avoiding them or escaping your stresses. Pursue healthy adaptation, exercising very good skills of stress management. Bring spiritual facets to your life. Spiritual dimensions can be fed through music, reading of scriptural books, meditating upon the Word of God, and bringing our concerns to God in prayer. Through prayer and closeness to God, you will be able to obtain a sense of serenity. Fill your life with faith and contemplate in the hope of salvation and eternal happiness. Now, as we come to an end, let me make the following important notes. Mental illnesses affects people of all age groups. It affects children, adolescents, and adults alike. Mental illnesses can begin at any age, from childhood through late adulthood and even in old age. But most of them begin earlier in life. There's a lot of stigma around mental illnesses. Compared to other illnesses, mental illness has been considered as shameful, a result of a curse or witchcraft or somebody's wrongdoing. And thus people suffering mental illness often decide to hide it, depriving themselves from the benefits that they could derive from professionals and members of the community. It is important for us to consider alleviating the stigma around mental health. Let us normalize mental illness just like any other illness. The effects of mental illness can be temporary and long-lasting. You can have more than one mental illness at the same time because the symptoms overlap and mental illnesses have a comorbid nature. Therefore, it's important to get proper diagnosis to know the particular type of mental illness that one is suffering from. There is no health without mental illness. Let us learn to treat mental illness with the same seriousness as physical illness. Practice prevention and seek help when you do not feel well. Even with mental illness, one can be happier, one can be healthier, and one can be more productive if they seek timely help and adhere to treatment. There are various types of mental illnesses. In the coming episodes, we will cover some of the most common mental illnesses that affect our society, bringing you information to empower you to take a step for better mental health and to equip you to help other people. That's it from us today. We wish you a happy week and a blessed week. Thank you for watching.